This Sunday, that 6th July 2024, we have completed 1422nd case of Puberphonia. So we feel so much proud and happy. We are helping the Puberphonia boys to a great extent. Here I want to emphasize a little more. We are treating totally deaf people. We are creating a little legible voice to them. That is our next project. One college principal says that is the biggest thing you are doing. Anyway, we want to concentrate on puberphonia and getting a legible voice for people totally deafness who are not able to talk, because there is a big stigma. All these boys with total deafness, they are away from society. They'll have their own life. So if they are able to talk a little, I'm not telling that we are giving a correct voice to them. A little legible voice we are giving. That means they'll be happily living with their family. That's what required. I thought this is a small procedure. The professor who visited to me today, he said that is a very big project and all over the world everybody will like it. This also you will have manipulation and resonance only, because we are bringing the resonance for these totally deaf people. They are having normal vocal cord and normal functioning of the larynx. They will cry with loudness. They laugh. They shout. So why not they talk legibly? That's what our intention. Great thing. We'll be able to achieve it. So that principal in a technical institution, he suggested he will make a project and we'll be able to do it. But the project, if you want to go and submit with a college to a funding agency like ICMR or science and technology, they will look into three factors. Any new project, technology. Number one is manufacturing. Number two is the amount of business they'll be able to make. See, manufacture and they will sell the product. Then the amount of business they'll be able to make it. The third thing is only social impact of your research. So I am just going to present to them with the 10 slides within a few days to make it as a project for their institution. So three things I am thinking: manufacturing. They want their student to manufacture something in related to puberphonia or loss of voice, which we are going to give a reasonably good voice. That's all. Puberphonia, 100% we have to make it all right. There is a failure also, but still we able to say that in more than 99% success. But deaf people not talking, there is a chance for good legible talking and they will be with the society. That is a great thing. So in technology, we are aiming for three things: manufacturing, amount of business, and social impact. So what are the things I can do in the manufacturing? The manufacturing, I am telling, we can manufacture a voice pitch analyzer. So a voice pitch assessment we have to do for all the boys, because most of the boys, they are having the doubt, am I having puberphonia? So pitch assessment mission, that is the first thing wanted. So whenever a patient comes to the ENT clinic or puberphonia clinic, or deaf, not able to talk, we have to assess their voice, how much pitch they are having. So a good voice pitch mission should be available. They should talk and take a printout, because in all the cases their health is normal, they are male, their vocal cords are normal, there is no other test required than the assessment for their voice pitch. So here one good machine we have to manufacture, that is the pitch assessment machine. For that, the important thing required in association with that, we have to find out that it is a very common problem and needs immediate treatment. That should be focused. How much social impact by a totally deaf boy? We know that it is a very big problem. If a boy is not able to hear totally, his voice will be mutated, or he won't be able to talk, not able to live with the society. So we personally feel that whole system can be changed. So we can assess the pitch, assess the voice. Here, very interesting thing I want to tell you. In medical field, in the first lesson for medical students, they teach us when we are student. Now also we are teaching inspection, palpation, percussion. Somehow stethoscope had become a popular. Then they have put auscultation also. Inspection, palpation, percussion, auscultation. Now, in puberphonia clinic, we want to put hearing, assess by hearing. You should listen to their voice, record their voice, and find out the problem. No other test is required. Other things are sophisticated tests, including functional MRI, that are all not required for these puberphonia boys or totally deaf boys who is not able to talk. That is a different question. So first, listen to them and record their voice. We are going to make the voice pitch measurement equipment. Then the important thing, what we are how to assess is the treatment we are going to change or divert a redirected phonation. Nowadays, everybody knows the phonatory apparatus is vocal cord. Yes, we are also telling like that only. But there are a laryngeal phonatory tissues are there in the human respiratory tract. Not only the vocal cord we can initiate voice. I am already telling repeatedly, there are 100 muscles that are working for producing the voice. So predominantly in ladies, vocal cord are so much active to produce high pitch. In male, more soft palate and uvula vibration. This vibration is much more than vocal cord, that tissue vibration. So we want to make it very clear. If you want to have a male voice, predominantly, you should have a pharyngeal voice. There is a difference between laryngeal and pharyngeal voice. Laryngeal voice is predominantly the vibrating tissue which produces sound, initiates sound, is vocal cord. In pharyngeal sound making, the predominant organ which involved in making sound is uvula. So this we should make a graph and show to them. So how to deal with that means you should have a apparatus. It may be a sensor or electromyographic study or some other waveform sound or ultrasound or fMRI or some magnetic resonance or ultrasound. We have to do the test and we have to record the vibration of the vocal cord or uvula, which is predominantly acting in producing the voice. Because we have found out in female, the predominantly active tissue in producing the sound for speech is vocal cord. In male, the predominantly active tissue to vibrate and make noise is uvula. In both the system, resonating mechanism, movement of the tongue, movement of the lip, that are all there. So we have to clearly assess whether this patient is having a laryngeal voice or pharyngeal voice. But this whole system, modern medical field or olden, there is a chest voice, there is a neck voice, there is a head voice, falestro voice. These are there which we are not able to understand, because basically voice is an art, treatment is an art, not a science. That is why we are not able to understand much or recognize much, not able to involve much the falestro voice. What is meant by falestro voice? Is it a head voice? Or there are many type of voice are there. They describe in so many, they used to tell us cateher or types of voices. So we are not able to understand, or only music learned people will be able to understand. Because in ladies, Usually in music, that too in English music, you can say, lady's voice is soprano, mezzo soprano, or contralto. So it can be a soprano voice, mezzo soprano voice, or contralto voice. But men's voice is divided into four: tenor, countertenor, baritone, and bass. They have given these names for ladies three groups: soprano, mezzo soprano, contralto, and gents four division: tenor, countertenor, baritone, and bass. This they have given in art basis. So in this science world, I hope so, we are not able to understand, or we are not able to learn it probably to understand soprano, mezzo soprano, contralto, tenor, countertenor, baritone, bass, understand all this group, not understanding. By hearing itself, you have to say. It will take long time. I hope so. Or it is formed in such a manner, common people should not understand these four for male and three for female. That we have to definitely break. So we have to form a definite scientific group. But if I am telling so, I am not against this. This is maybe very good, but the knowledge for a medical man, it is very difficult to, on hearing the voice, whether it is soprano, mezzo soprano, or contralto, or tenor, countertenor, baritone, or bass, it is very difficult to understand and proceed according to these things. These are all musical tones. So this is classified very well. And definitely this may be very helpful, but we are not able to understand. That is the big problem. So we personally feel this is good, but when the world is changing, we have to adapt some other method by which we'll be able to deal with that. Because very simple voice I can say. One is laryngeal voice, another is pharyngeal voice. I'm just forgetting about chest voice, head voice, falsetto voice. I'm not, my feeling only. It may be wrong or it should be corrected. Yes, definitely. My feeling is I am taking two type of voice only. All are having, male or female. One is laryngeal voice, another is pharyngeal voice. So say laryngeal voice, say pharyngeal voice, hello, how are you? That's all. Why I am telling that? Mean this should be recorded. This should be assessed. A machine should be available to record the activity of the musculature involved in making laryngeal voice and pharyngeal voice. We have to record what are the changes. From the changes itself, we should tell this patient is having more laryngeal voice or pharyngeal voice. This is very, very, very important because I want to give an entirely different chapter for diplophonia. Diplophonia means two sounds occurring in different pitches. This they have given a lot of explanation in polyp cases, vocal cord polyp, vocal cord operated, vocal cord paralysis, one vocal cord small, one vocal, all the things they will have diplophonia. That is what the book says. But sorry to tell you, my view is different. It is not, the diplophonia is not originating from the vocal cord. Quasi-pediatric vibration of the vocal cord, they say, diplophonia cause. Two vocal cords are there, so they are vibrating in different pattern. That's why you are having double voice, diplophonia. One same time, two different pitch of sounds are coming. It is called diplophonia. They say the vocal cord, there is a quasi-pediatric vibration of the vocal cord. But my view is little different because diplophonia means high pitch and low pitch voice are there for all human beings. One is laryngeal, another is pharyngeal. In ladies, laryngeal voice is predominant and gents, pharyngeal voice is predominant. But in diplophonia, double voice, both are coming alternatively, laryngeal and pharyngeal. It is nothing, I personally feel it is nothing to do with the vocal cord. How can I say that? For that, a machinery should be available, machine should be also available, electromyograph or some other vibration will be able to assess the majority of the tissue making the noise is vocal cord or uvula or soft palate. So electromyography, you can get an impression of the superficial muscles or superficial nerve, which is more active at the stage. Now, what is the thing acting? So we can find out because the electrode can be placed on the nerve or in the muscles. So we can insert a sterile needle and we can find out the activity of the muscle or nerve. This one, even 40 years back, we used to do parotid surgery. We used to have the nerve detector because we are more worried about the facial nerve. We should not injure the facial nerve when doing a parotid surgery. What happened is the facial nerve run through the parotid gland. There is a superficial layer and deep layer. So when we want to remove a total parotid surgery, we should preserve the facial nerve. Sometimes we won't be able to differentiate between a nerve and a fibrous tissue. That time, the nerve detector machine, a vibrator is available. We used to keep it in the operation table itself and find out whether it is nerve or not. This is, I can say always with the anesthetists and even the plastic surgeon, they used to keep with them. in all the major surgery in the muscle and nerve, this detector should be available. So it is the second instrument we have to make. Number one instrument is in clinical examination, the voice pitch recorder. Second instrument is without injury, we have to do the nerve or muscle activity. Here, the muscle is not superficial one. We have to assess the activity of the muscle working in the vocal cord and the muscle working in the uvula and soft palate. These are all deep inside the neck, inside the mouth. So more meticulous work is required for making the two apparatus. So this is initiated by one college principal for me. For if you want to have a good project, and that too useful to the society, and if it is needed to be manufactured or scientifically they have to do it in a scientific institution, we have to go ahead for manufacturing some of the equipment needed for puberphonia treatment. Then only scientifically it will go and approach all over the world, the institutions. And we can say that we are having this apparatus, you can purchase, then you can proceed. Because not only it will help us in detecting the disease, we will be able to go ahead with the prognosis of the case and success of the case, and we can be able to give a correct account how much percentage of success for puberphonia treatment is there. Definitely this is going to help us in a long way, and we have to manufacture it. The manufacture also, my feeling is not so simple. All are telling it can be done, it can be done. But there's no a solid project minded institution is, I have not seen so far in Chennai. Every engineer, every computer people, every people who are interested in research, they will say, I'll be able to do it. Sensor, I'll be able to do it. But whether they have done it so far, this is the questionable. Because unnecessarily we cannot go and spend money if they are not able to make it out. All are willing to do and try to do that. That is not our, we cannot, because we are not having a funding agency for the same. Anyway, I hope we will able to do it in a great manner. These two instruments, number one is voice pitch recorder, number two is a sensor to find out which group of muscle is active, whether laryngeal or pharyngeal, because this is going to give a good idea for my next book, a test book on puberphonia. So today we are a little more interested in entering into the scientific approach for the treatment for puberphonia, and it will be successful because today we have crossed 1,422 cases of puberphonia on this day of Saturday, 6th July 2024. So we will be able to go ahead with the research in collaboration with some good institutions which will be able to help us, or mutually they will also be benefited. So the technology, if your college should take, means manufacturing, amount of business they will have, and social impact. So let me see next Saturday what is the progress I am making. Happy, happy, happy. Thank you.